Hi, my name is Lydia Simpson and I'm going to be discussing a recent paper published in the Extreme Environments Special Edition of Experimental Physiology. Most highland native populations show excellent adaptation to the high altitude environment due to their generational exposure to ambient hypoxia. However, a small proportion of these individuals, between 10 and 15%, cannot adapt to ambient hypoxia and develop the maladaptation syndrome chronic mountain sickness, or CMS. CMS is most prevalent in individuals native to the South American Andes and is a condition characterised by excessive erythrocytosis and exaggerated arterial hypoxemia for the resident altitude. Importantly, CMS is also associated with an increased risk of cardiovascular disease, including the development of hypertension. However, it was previously unclear as to whether altered autonomic regulation of blood pressure was apparent in those with CMS. Therefore, during the 2018 Global Reach expedition to the Cerro de Pasco region of Peru, we assessed integrative control of resting blood pressure in 7 healthy Andean highlanders and 8 Andean highlanders with mild CMS. We assessed total blood volume, sympathetic vasomotor activity via microneurography, and also assessed arterial baroreflex function using the modified Oxford test. As expected, those with CMS had lower arterial oxygen saturations compared to healthy highlanders. They also had higher hemoglobin concentrations, higher hematocrits, and a larger red blood cell volume. And this resulted in a larger total blood volume and a higher blood viscosity. Despite this, cardiac output, total peripheral resistance, and therefore mean arterial pressure were similar between groups. In fact, the higher total blood volume and higher blood viscosity in CMS was balanced by a lower heart rate and lower sympathetic vasomotor activity. Furthermore, the sympathetic responsiveness to acute fluctuations in blood pressure, i.e. the sympathetic baroreflex gain, was similar between groups. Also, the heart rate responsiveness to acute fluctuations in blood pressure, i.e. the cardiovagal baroreflex gain, was actually augmented in those with CMS. Therefore, autonomic control of blood pressure was well preserved in individuals with CMS and does not appear to contribute to the increased risk of cardiovascular disease reported in this population. A lower heart rate and lower sympathetic vasomotor activity appeared to be a compensatory response to excessive erythrocytosis and an increase in red blood cell volume, and allow normal resting arterial pressure to be maintained.